Thank you everyone for joining us this evening to learn more about the admissions process at Logan University. Tonight we have with us Executive Admissions Coordinator Sam Holyan. Sam started at Logan back in June of 2015 after he graduated from Truman State with a bachelor's in psychology. He was born in Washington State and moved to St. Louis when he was a freshman in high school. What he loves about Logan is that the faculty, academic support staff, and even the other students all want each other to succeed. Many people or schools will say that they want their students to succeed. He firmly believes that Logan puts students in a truly advantageous position for their future in the profession. Sam?
Thank you, Stephanie. That was a lovely introduction. And thank you, everybody, for joining us this evening. Really excited to share a little bit more with you about Logan, about our program, about the admissions process, and kind of give you a little bit kind of an insight of what to expect. So real quick, I am going to share my screen with you all. Let me get that up and running. Oh, looking at a couple different things. Let's get the PowerPoint going. There it is. Okay, so like I said, as this is going to get rolling, just want to give you a little bit of an idea kind of what to anticipate with the application process. And kind of as you're thinking about becoming a student here at Logan, just sort of what to anticipate, as you're diving in. Really at the heart of this process, there's two primary questions which I've got listed up here. Why should you choose to become a chiropractor, and why should you choose to partake in the education here at Logan to become a chiropractor? There are lots and lots of reasons to do so, for both of those questions, but I've kind of highlighted a few that I think are pretty universal and that really stand out to me as to why this is such a great profession, why we've got such an amazing program at Logan. First and foremost, chiropractic, you are truly able to make an incredible amount of difference in people's lives and make a really clear improvement to the quality of life that people can live, getting them out of pain, and seeing them lead much better and healthier lives is an amazing thing. And I think our program sets you up really, really well to be able to do that. There's a ton of growth within chiropractic right now. There are a lot of new ways that chiropractors are able to kind of expand beyond just the traditional kind of solo practice settings, working with different types of healthcare professionals to really, again, provide the best quality of care, which is exciting. It's also not a bad way to make a living. Pretty competitive pay, and because of the ways that you're able to run and structure a practice, you're able to go through schooling, really leave with an amazing skill set, but also set yourself up to really live a good life and have good work-life balance as well. And then again, primary care, again, really being that kind of portal of entry physician to be able to work with anybody that comes through your door, be able to kind of be the head of a team working with different healthcare professionals if you choose to do so. More specific to Logan, I think there are lots of reasons that our program is unique and kind of different from other schools. In particular, the few that I really think stand out the most, the amount and the variety of the clinical opportunities that we present, I really think is unmatched, whether it be with veterans, with athletes, with pediatric prenatal care, with geriatrics, with severe physical disabilities, with the low risk kind of low income at risk populations. I really don't think that there's a clinical program that really can match what we're able to offer for students, including kind of private practice experience. The hands-on curriculum, something that starts from the day that you get to campus to give you these real life-like experiences that get you from where you start as a brand new student to be ready to go out into practice and confidently treat any patient that comes through your door. That's integrated and kind of baked into everything you do while you're a student here. And again, it starts right from the time that you get to campus. The ability to kind of personalize and customize your training, I think, is also so crucial. We recognize that because of the new and ever increasing number of opportunities and places that students are able to go with their practices, we definitely want to make sure that you have the tools and a clear pathway to create your ideal future practice, whatever that might look like. So whether that be from the techniques or those clinical opportunities, the ability to work with the faculty to help kind of foster your perfect clinical setting, we definitely want to be able to do that for you. In the community as well, whether again it be your primary instructors, these academic support staff, to the other students, whether they're in your class or beyond. I think we have an amazing group of people to welcome you here to campus in St. Louis and make sure that you have somebody there to always support you with whatever you need help with while you're a student here. This is by no means an easy thing to do. It's definitely a rigorous program that will test you all along the way. But we definitely want to make sure that there's someone there always with you to get you through and make sure that you have every resource that you need. So just kind of a quick little look at that. So let's say you've decided, you do feel you've got a clear idea. Chiropractic is the route that I want to go, and Logan is the place that I want to be for that education. So really, then the question becomes, what's required of a student to then enter into our program? In addition to the actual application itself, which is available through our website, there's three primary components that we're going to use to evaluate you as a student. The first of which is your statement of motivation. So in a nutshell, it's really just a kind of a quick entrance essay going over, again, those two primary questions of why are you choosing chiropractic? Why are you choosing to come to Logan? But in addition to that, we're really looking to kind of allow you to dive a bit more into your background about who you are. What are the experiences that you've had that have gotten you to this point, to that conclusion? Whether it be working with a doctor who's been somebody in your life that's been really instrumental, whether that be a Logan grad, whether it be another chiropractor, or even a different healthcare professional, whatever that might be. We want to hear more about that. Specifically, would love for you to be able to kind of share from what you want out of chiropractic and what you want out of your education. What is it that Logan does that really speaks to you? Why does it feel like it's a good fit? I think that fit component is super, super crucial. And so definitely taking that time to kind of evaluate what is it about what we do that's going to be able to allow you to do what you most want in the future, I think is also really important as well. And then also, how will it allow you to grow, and what will coming to Logan mean for giving back to your community, being able to create a new practice environment in your area, something like that is really important as well. So the next kind of big component will be a letter of recommendation. And we tend to get a lot of questions about this in terms of formatting and kind of some of the specifics. Really, the major component is that it does need to come from someone that is still a practicing chiropractor. We value the insights that's from someone who is not only still in practice working with patients regularly, but also somebody who's gone through this type of education in the past. They know what it takes to get through a rigorous program like this. They've been in your shoes before as a new student. And so their insight of having gone through it all and been able to get through it is really, really valuable for us. So it's really kind of, we want to know more about you directly from the source in terms of your essay, but we also want to know about you and your qualifications from somebody that's been there before. It doesn't necessarily need to come from somebody who went to Logan. That certainly doesn't hurt, and we love to see whenever we've got Logan graduates who are active with our students. And the other question that we typically will get a lot is, oh, do I just need to submit one recommendation? And that one primary recommendation is what we'll look for. If you have anyone else in mind, if you have worked with other healthcare professionals, faculty, employers, mentors, or whoever it might be, and they have either expressed an interest in recommending you, or you have somebody that you would like to ask for a recommendation, you're more than welcome to include those as well. And like it says at the end, they do tend to hold a lot of weight. That time and that insight and kind of expertise of the people who recommend our students really does go a long way with our admissions committee. So the final kind of component is a little bit more technical, but it's official transcripts. And of course, with any kind of academic program like this, we definitely want to ensure that you have met particular criteria in order to be able to successfully get through our program. I'll kind of quickly just go over two kind of sort of housekeeping things that you see up there. They do need to come directly from the school. In order to qualify as an official transcript, it can't go to you as the student first and then sent in. It becomes unofficial in kind of an interesting kind of higher educational way. And then if you have attended multiple schools, even if it was for really only one class or two classes, it's incredibly important for us to do as thorough an academic evaluation as we possibly can. So we do ask that you submit transcripts from any school that you've attended previously. I've listed below the three primary criteria that we look for our students to meet in terms of academic qualifications. I will highlight a couple things in there. The 90 semester credit hours that are kind of the minimum expectation, that again is in order to start the program. We do really recommend a student complete a bachelor's degree because it opens up a few doors for you as a student. The first of which is actually while you're a student here at Logan. by having a bachelor's degree, in addition to meeting these requirements, does qualify you to enroll in one of our concurrent master's programs, either our sports science and rehabilitation or our nutrition and human performance. Those degrees really give you an extra advantage, an extra tool for your tool belt that you don't necessarily get elsewhere. But again, they do require that extra academic component prior to starting. Um, there are also quite a few states that require it in order to obtain a license as a chiropractor. So it's certainly something that we can work with you on. If you are from a state that doesn't require it and you know for sure that you are going to forego those master's options, it doesn't mean that you can't start without that degree. But again, it's something we definitely strongly recommend. The GPA, the science hours that you see listed there as well, again, are very crucial components. We understand that sometimes students come from situations where they don't exactly meet all those requirements, but that is not an automatic no. So to say, hey, if you don't have a 3.0, if you don't have at least 24 hours of science, that there is not an option for you to become a student at Logan. Part of what I love about working here is how we get to work with students very individually, kind of evaluate your situation on a one-by-one basis. A student that comes in with, say, a 3.4 cumulative GPA versus a student that comes in with a 3.5, that is not going to be the single kind of make or break piece to an application. We try and look at things much like the chiropractors at Logan try to look at their patients very holistically. One single component usually is not a reason why a student won't be able to move forward. And typically we can work with you to ensure that even if we have to kind of shift things around, whether it be timing or taking some extra classes or whatnot, we can make sure that there's everything in order for you to continue forward with the admissions process. Another question that I tend to get quite a few from interested students is what makes a strong applicant? What, with lots of seats being available, and the process again being very kind of individualized for students, what is it that makes one application stand out from another? I think, again, like I said, meeting and exceeding those academic requirements will do nothing but aid your application with our admissions committee. Knowing that you have put in the hard work to prepare yourself for a program like this is certainly will not go unnoticed. Strong recommendations as well, I think, is certainly really valuable. They're being able to share their insights, and speak that they feel confident that you are going to be able to handle the rigor of the program like this, I think, is really, really important. Shadowing is something that, again, isn't strictly required, but I think kind of speaks to the previous point. Again, it's sort of a matter of sort of doing your homework, taking that time to really ensure that this is what you want to do. And in most cases, at least in my personal experience, when a student does take some time to shadow either with one doctor or with multiple doctors, it does really allow them not only to have a better perspective on what the profession's going to be like whenever they're done, but also it typically leads to some really, really strong recommendations as well. So that's something that, while not strictly required, I don't know that I could recommend that highly enough. And then that communication component as well. This can typically be a pretty quick moving process. There's lots of moving pieces. I myself don't really work with a lot of students who are local. So pretty much everybody that if I'm a part of your admissions sort of journey, one of the big things that you'll be doing is picking up and you'll be moving out here to St. Louis. And as someone who's made several big moves in my own life, I know that can be a especially stressful process. And there's lots of kind of fun moving parts that go with it. And that consistent communication will be really important, because for me personally, and I know for all of the coordinators who I work with, it's incredibly important for us that your transition to Logan, if you do choose to be here, is as smooth as possible. So staying in touch with us, making sure that when there's questions, when there's issues, that you present them to us so that we can best assist you with that. So that is pretty much everything. Again, there's a few kind of primary steps that we'll go through. One thing I didn't really include on here, but if you are interested in seeing about your academic qualifications prior to applying, that is certainly something we can do. We do offer free unofficial transcript evaluations at any point. So you're welcome to send those either to myself, to your direct admissions coordinator as well. We'd be happy to look that over. And again, much like no two students are exactly the same, no two students come with exactly the same life situation in terms of what questions and what factors are most important to them. So if you are thinking about applying, definitely reach out. We're here to support you and make sure that when those questions do come up, we're able to best address those. So that's pretty much everything I've got for right now. So I will kind of stop sharing my screen and kind of turn things over to everybody if there are any big questions.
Does the question have to be about the application process, or can it be about the school?
It can be about anything.
I want to know about, so when you take up the board exams,
Mhm.
you get your score,
Yeah.
do you have to take it in the state you want to practice in?
Ooh,
Or
that's a good.
do they look at your score and they go, your score is high enough for these states?
That's a great question. So the way that chiropractic functions is that there is a national board system that every student practicing in the U.S. needs to take. Each student will be required to complete all 4 parts in order to qualify for licensure anywhere here in the U.S. Those are typically taken during the program. Most students are completing all 4 parts periodically throughout their time here at Logan. That being said, there's some additional components beyond that in order to actually get a license within a state. But typically, in order to do so, you need your chiropractic degree completed and all 4 parts of national boards done as well. From that point, states will typically have a licensing exam that you have to take. So it's just for sake of argument here in Missouri, if you graduate from Logan, all 4 parts are completed, then there's I believe they refer to it as like a jurisprudence exam, kind of covering the scope of practice, the laws that govern chiropractic here in Missouri. And from that point, that's when you've got your license and are able to start practicing.
So
What were those two master's programs that you mentioned earlier? Can you repeat those again?
Yeah, absolutely. So there are 2 programs right now that our DC students can do concurrently while they're enrolled in the chiropractic program. The first of which is our Master's of Science in Sports Science and Rehabilitation. Most people will just call it our sports rehab program. The other is our Master's of Science in Nutrition and Human Performance. So both of those programs are eligible to be completed starting in trimester 5 of the DC curriculum. And they're structured in a way that if you decide to do that, if you stay on track with everything, you can actually graduate on the same day with both your master's degree and your doctorate degree. So you can complete both programs at the same time.
do you have to be physically strong to be a chiropractor?
Ooh, that's a really good question. We don't tend to get that one a ton. There is a certain level of, I think, physical, maybe skill is not quite the right word, but there's definitely a physical component to things. I will be completely upfront with this. I'm not a chiropractor myself. I just work in admissions, but have been fortunate enough to be here for close to 6 years. So have worked with a lot of our faculty, and I know that we do have quite a few people coming in from kind of a very broad range of kind of physical spectrum, if you will. Pure strength is not the most important factor in a lot of this. In most cases, actually in a lot of cases, the positioning of the patient, the speed, and kind of the precision of an adjustment can often be a lot more important than just kind of muscling through it. So there's definitely a lot of work that can go into it. So it does not necessarily give a major advantage to the larger, stronger people. I think in a lot of ways that focus on, again, that precision and that speed and the correct alignment of adjustment, whatnot, can be in a lot of ways more important. So hope that kind of addresses your question.
So I was in contact with a woman from Logan for a while, just discussing different things about like admissions and stuff.
Sure.
But she is no longer with Logan,
Okay.
and I wasn't exactly sure who I needed to be in contact with.
Sure. Let me. I just saw that kind of popped up. Your name, Kyle, is that right?
Yes.
Okay, perfect. So I will actually check in on that, and I can actually send you an email when we're done, kind of making sure we get you connected with someone.
Okay, awesome. Thank you. I appreciate it.
Of course.
If I wanted to do that unofficial transcript evaluation, who would I need to contact about that?
Yeah, so you can actually send that directly to me if you'd like to. So again, I will, before we kind of wrap up, I will put all of my contact info in the chat so that you all can reach out if you need it. What I'll also do is if you don't happen to be from a state that I work with directly, I can also pass that information along to the appropriate coordinator. We have a really amazing group of DC coordinators here at Logan. We all kind of work with students from different areas. So again, if it's not necessarily directly with me, I'm happy to make sure that it gets to the right person.
Do you guys have any campus tours?
All the time. Yeah, we have a bunch of campus tour options for students. We have a kind of a primary visit day that we do on most Fridays. That's kind of a full tour program that we do an information session. There's lunch provided, a time to meet with some current students as well. In addition to the actual full tour itself, financial aid as well. But we've also expanded a little bit here recently with kind of some of the COVID restrictions needing to make those Friday tours a little smaller. So in addition to those Friday tours, we do have a select number of tours on Mondays that are specific for students who have applied for the program. We also can do private tours as well with a student and up to 2 guests. That's just kind of during normal business hours, Monday through Friday. If for some reason, like the structured kind of formal visits don't quite match up with your schedule. The other thing that we've done a little bit more recently is actually opened up some new virtual tours as well. So one of my coworkers, Robert, is starting to do kind of a biweekly virtual tour option with students. So another thing that we can certainly provide some additional info for you to get that set up. If you can make it out to St. Louis, we do love to get to meet people here in person on campus. For those visits, we can provide you with a complimentary hotel stay. We can set up your accommodations for you. We can also do some travel reimbursement as well. Want to cover some of that cost for you to get out to St. Louis too.
If I wanted to do that,
Mhm.
is there like a place on your website you could sign up for that?
Yeah, absolutely. So just through the Logan website, if you were to go onto just logan.edu, there is a primary section right towards the bottom of the page that just says visit. If you click on that one, it should take you to the available visit dates. I believe that's where our Friday visits, but there's additional information on there for setting up other visits as well.
What is the admissions deadline for the next semester?
Yeah, that's a great question. So we don't actually, I covered this. So our program is a little bit different than maybe some other institutions you might be familiar with. We run a trimester system. So we actually have 3 start terms every year. Students can start in either January, in May, or in September. And so for all of those terms, what we typically recommend a student do is apply about a year prior to their intended start term, just to give yourself plenty of time to get through the admissions process in terms of getting a decision, and then again, really focusing in on that transition to being here in St. Louis, making sure that all goes really smoothly. Specifically for our next term, which is going to be starting in September, seats have filled up a little bit quicker than they typically do. So what we are recommending right now, with kind of the limited number of seats still available, would be to get an application submitted by June 15th would be kind of a good ballpark time to get that submitted. Now, again, if you had some questions about meeting the academic requirements prior to that point, by all means, feel free to reach out to us, let us know. We're happy to look over transcripts and ensure that before you apply, we can give you a better idea kind of where you stand with that. But just generally speaking, again, I would say a year before your intended start is a great time to start that process.
There's the same number of seats in each trimester?
That will vary. The reason I said that seats have filled up a little quicker than they typically do, we've seen that for a lot of students, especially with COVID, did seem like that people did kind of put things off for a little while. So just kind of delaying for a year. We've been really fortunate that things in our area have improved quite a bit. Starting to see that things look like we could be getting everybody back to campus in the fall at some point soon. So we are definitely keeping an eye on the number of students that we've got, especially with the space here on campus. we don't have a formal cap in any of our classes, but the number of students per term typically varies. Our fall class is somewhere around 150 to 160 students on average. The January term, which we call our spring class, is usually somewhere between like 60 and 70 students. And then our May term, typically between about 50 and 60.
We getting letters of recommendation sent in. Like how would that work with the rest of the transcript? Would we have to have those? Would it be best for us to have them, the person sending the letters of recommendation to us, and then we send them to you, or directly to you from them? How would that work?
Yeah, that's a good question. So either option that you presented is totally fine. The means by which we get those recommendations, we're a little bit less. We're pretty flexible about that. Whether it comes to us directly from your chiropractor or if it needs to go through you first. Typically, again, with those documents, that's something that you could just email over whenever they're ready and available. Transcripts as well. I know some schools are still doing things maybe a little bit more kind of old school where they're only doing paper transcripts. Of course, they can be mailed directly to us, but if your school does electronic official copies, you're also welcome to email them either just to our general admissions email or directly to your coordinator too. Those other two items, the essay and the recommendation, also can be sent separately after you submit your application.
Do you know what % of applicants you accept versus don't accept?
So like I mentioned, we are currently in a position right now for all of our classes where there isn't a formal cap on any of them. Now, should that change, of course, we'll notify students, kind of let them know that were to change. But we're also on rolling admission. So for some reason, if a student needed to defer an application, that is something we could potentially look at doing. In the case that a student does apply, if they do meet those academic qualifications, there's a pretty good likelihood that the coordinators can work really closely with our admissions committee to ensure that there will be a seat available. Again, really, it kind of comes down to your specific situation of what term is going to work best for you and making sure that you will have a smooth transition to starting. So again, no specific cap as of right now, but we'll work with you to figure out kind of the logistics of what's going to make sure that you've got a really smooth transition to starting.
I see, thanks. If you get accepted, when would you start working on tailoring the program to what you're interested in specializing in?
That's a great question as well. So the initial parts of the program, the first year in particular, there is quite a bit of the curriculum is kind of preset. There's a lot of basic science coursework that you're going through, but there's also a lot of kind of hands-on training in terms of some of the clinical skills and whatnot. The kind of the major area where, as far as a curriculum standpoint, that you get to kind of start customizing some things is when the elective technique options come into play. So our DC students here at Logan will go through training on 4 core technique adjusting methods that they'll learn. But there's a really big range of elective options that they'll get to choose from as well. So those will come into play typically starting around trimester 5 and 6 is when those become available. And you can continue to do that through the remainder of the program. That being said, that's not the only point at which you can really kind of dive into maybe a particular area of interest. We've got some amazing clubs and organizations on campus, many of which are specific to different techniques, practice management styles, philosophical kind of approaches to things. So again, you can, even if from a curriculum standpoint, you're going through similar classes to your classmates early on, there's ways to kind of start to develop a better idea of, again, what might my practice look like down the road. And then again, with the master's option, another awesome way to kind of customize things, that again will come into play usually right around trimester 5. The largest sort of customization area, I would say, is typically the clinic system, because you get a huge range of offsite rotation options that come into play kind of towards the tail end of the program, that allow you to pick very specific kind of specialty groups or sort of subsets of patients to focus your care on. So it'll kind of come into play all throughout the program.
So this may not be really an admissions question, but I guess it's part of starting out at Logan. So you guys don't have on-campus housing, but what's like an overview of how does someone get set up with local housing?
That's a great question. So while it may not seem like a traditional part of the admissions process, it certainly is a really crucial piece to what we do here at Logan in our admissions kind of timeline. We actually have a coordinator named Leisha West. She is our admissions engagement representative, and her primary role is to work with all of our incoming students to assist them and aid them in not only the search for housing, but again, that transition to being here in St. Louis. So we all on the admissions side live here full time. While I'm not originally from St. Louis, I've lived here for close to 15 years, and with new students starting every 4 months, we're really familiar with a lot of the options that are available to students. And no matter how specific it may need to be, there's typically going to be an option that's available to you. So if anything, probably too many that you have to kind of sift through. So we definitely can do a little bit of that legwork with you. From looking at some of the local apartment complexes to townhomes, condos, even potentially some students looking to purchase homes as well, finding roommates, and again, trying to just get settled and acclimated to the Chesterfield area. That's a big part of what we'll do post acceptance in particular. So Leisha, again, is an amazing resource for our students, and she works closely with each of the individual admissions coordinators, including myself, to ensure that every student is not left completely on their own to have to find a place to live when they're moving out here.
I checked the visit tab on the website, and the
Sure.
next available Friday visit, just the only visits listed are in August.
Yes. So like I mentioned, with COVID kind of modifications and restrictions, we have had to move things around a little bit. We have been only limited to a certain number of students for each visit. So if August is a little bit too late for you to come out, again, there are a couple different options. Let me track down. Again, that there are some of the virtual tour options that we have available, but we could also work with you individually to do more of like a private tour as well. So that really could be kind of as soon as you're ready. I actually just scheduled one for a student to come out next Monday, earlier today. So even with
I'd like to do that.
Sure, yeah, even with just a couple of days of turnaround, we should be able to get something set up, and again, be able to do housing, hotel accommodations, and do all that for you. So let me. Have you been working with someone specific in the admissions office before?
No.
Okay, gotcha. Well, if you're okay to stick around for a little bit after we kind of wrap up, we can chat and we can maybe work on getting something set up for you.
Okay, thank you.
Any other questions for right now? Okay. Well, like I said, again, before we kind of wrap up, I'll make sure I'll go ahead. I'll throw my information in the chat again, so that if you guys do have questions, that you can certainly reach back out to me. And if again, it's we don't end up working together if you're from a state that's not really kind of part of my territory, we'll definitely make sure we connect you with your specific admissions rep. if you do feel like sticking around, if you do have specific questions, definitely feel free to do so. But thank you all again for taking some time to chat with us this evening and hear a little bit more about the admissions process here at Logan. Would definitely look forward to working with you more and hopefully seeing you on campus sometime soon.
It was helpful. Thank you.
Wonderful. Thank you very much.
Thanks. I appreciate it.
Absolutely.